many of you have heard of healthcare reform? Okay, that's good. And how many of you read the whole 1,600-page bill called the Patient Protection and Affordable Care Act? Somebody raised a hand. I don't believe it for a second. Our job is to create a site that is the public-facing site for healthcare reform. People ask what it is. Our site is designed to answer that question and give people access to the tools that they need so they can access the services that are available to them. Probably the best compliment that we get is it doesn't look anything like a government website. And that's partly because, as the presenter here mentioned, people in different constituencies want everything on the homepage. They want everything on the site. We decided early on we were going to focus exclusively on consumers, citizens. There'd be other places for other stakeholders. And it's very rare for a government agency to do this. We got support from the White House to do it. We got support from the top of HHS. That really explains why we're able to make it a site that really doesn't look much like a government website. I just want to show you two features in this 5 minutes. Read, if you could go to the yellow tab there. Under understand the new law. There's so much about the law people don't understand. We've tried to make this a very user-friendly front end so that people can figure out what the bill means. The real showbiz part of it is, if you click on the timeline, you will see how that 404 thing? We put that on the top of each page just to fool. No, that's not true. That's because of local wireless. That ain't us. We created this timeline which has all of the provisions of the Affordable Care, many of the provisions of the Affordable Care Act planked out here so you could see. So you could go through it and you say, what is healthcare reform? You could go through and find out all the provisions between now and 2015. And if you click like that, it scrolls really cool, and we're very proud of that. Again, government sites aren't supposed to be cool like that, but we did it anyway. So people can find out about the Affordable Care Act here, and also they could get access to tools and information. If you click on the top left tab, Find Insurance Options, we've developed a tool that allows people to find options, to find information about their insurance options very quickly and easily. We've streamlined this process incredibly, and again, we're very proud of this too. So you can put in which state you live in, put Maryland in there. You choose your state. Don't say you're a pregnant woman. Say you're an individual with a medical condition. It's much more convincing. So far, we've asked you just 2 questions. Click Next. Just a few more questions. Let's say I just need health insurance. Let's just do that one. I'm 26 to 64. Do any of these other things apply? And in this case, let's say no. Do you find it difficult to afford health insurance? We find that that's almost universally answered yes. But I'll explain why we do that in a second. Click Submit. You'll notice we just had 7 questions. And what we've been able to do for the first time is give people access to information that shows all of their insurance options in one place, public options and private options. If you want to buy in the private market, it's there. If you might be eligible for a public program, it's there. Never been done before, and it's customized to your unique situation. Let's go to, so people can find out there, are they eligible for Medicaid? They'll be able to find out, and they will get Medicaid information based on what state they live in. I'm really fading it out here, sorry about that. Finding care you can afford is access to community health centers. If you're unemployed, if you don't have much money, as a lot of people write to us say, what can I afford? The answer is there are community health centers that are available to you. So you get all these options. But let's go to number 2. We could really get into some showbiz here. Health insurance plans for individuals and families. If you want to buy health insurance, you could go to a broker. You could go to a .com and you could find out some options. We are this dispassionate source of information. We just want to lay out your options. Here, let's put 20814. That's in case you live downstairs at the barking dog. I think I saw someone downstairs who looked like he lived in the parking lot. Say you're in 20814. What we've done is return to you. We didn't even have one of those spinner things like Travelocity has. We just did it immediately. You see all the companies that are offering insurance plans in this zip code. You'll see there's 16 plans by Coventry Health, there are 2 plans by GHMSI, and then you could click on any one of these. Let's say the Time Insurance Company. You view the plans, and you'll find information about those plans and the 800 number to call. Now the really cool thing is on October 1st, we're going to start to get pricing available for each one of these plans. It's going to be much more like what you see on the commercial sites, but we will never be a broker. Our job is simply to lay out the information as dispassionately and completely as possible. This technology, we're supporting 3 billion different information combinations in order to surface all this information, just a huge technology lift. It was a very small team that put it together. We somehow did it in 90 days. Ted Shea, ladies and gentlemen, right in the back here. Technology guy, largely responsible, partly responsible for getting this whole thing stood up in this time. The law was signed on March 23rd. By July 1st, the legislation said we had to have the site launched. So we simply had to do it. It was not an option to extend the deadline. So we did it. We do have this new stuff coming out up on October 1st, but one of the things I did want to point out was that people always talk about the digital divide and reaching underserved communities. Reed, if you would go and click en español, you can see what a great Spanish speaker I am. That's the wireless issue, it's not us. You will see the entire site is translated into Spanish. So that's something that we were able to launch just recently, but we will do that going forward. Everything will be live translated. It's a mirror site. Everything on the English side automatically is translated in Spanish. I'm out of time. I will leave it to that, and thank you for your time, and happy to take questions afterwards.